Well, joining us right now is Dr. Abubakar Jafia. He's the Assistant Director, Surveillance and Epidemiology with the NCDC. He joins us via Zoom in Abuja. Thank you for joining us on the program.
Thank you so much for having me.
All right, Doctor, this week we've been recording very low case numbers. Last night, 17 cases. The day before that, 12. Monday, 7 cases. But the good thing is the death toll has remained the same. But we also noticed that some of the reports, the NCDC shows a list of states recording 0 cases for weeks and some even over a month. Can we say that, in those states, community transmission is non-existent and that there is or was adequate surveillance in those states?
Yeah, so first and foremost, I want us to be clear about what we refer to as the test positivity rate. This test positivity rate is an indicator that is used to understand the level of transmission of coronavirus. And this has been fairly around 1%. What it means is that, 1 out of every 100 people tested in Nigeria are positive for COVID-19. We are also, we know that there is a decline in the number of confirmed cases, and we are fairly confident with our testing. Also, it is very important to really mention that there is still high incidence of COVID-19 cases globally. There is widespread prevalence of, variants of concern. And so this goes to remind us that the risks of the virus, still exist across the globe and Nigeria as well.
We'll come to the variants shortly, but I want to ask about if we can still say we are at that community transmission stage, or we can say that it's just 1 case or so that we're getting. Would you still say that with the cases we're recording each day, we are at that community transmission state?
So the level of transmission has reduced slightly. Like I said, the test positivity rate is the indicator that will show us where we are. It has slightly gone down, but like I said, the risk is still there.
How does the NCDC verify the information coming from the subnationals on confirmed cases?
So really, one of our biggest priorities as NCDC in leading, the public health response to this pandemic is to try to provide and maintain accurate data about the rapidly, evolving situation. And we do this in close collaboration with all the states, that have this outbreak. So what we do is that upon diagnosis of cases in any of our accredited laboratories across the country, the data is shared by the laboratory to NCDC and of course the state ministries of health for verification before this is, published. Also, I probably need to mention that NCDC has deployed, an open source software referred to as SOMAS, which is Surveillance Outbreak Response Management and Analysis System, across all the 774 LGS in Nigeria. This enables us to have comprehensive reporting and analysis of COVID-19 cases, COVID-19, and of course other diseases in real time. So regardless of the challenges that we probably have here and there, we remain committed to ensuring transparency in reporting our data all the time.
Does this also apply to testing that is ongoing? Because, some states are testing between 20 and 30, while some others are not. We're not seeing the reports.
Yeah, so also, we have established laboratories across all the 36 states and the FCT. These laboratories remain open and they are functional. We have not run out of any reagents or supplies in this laboratory. Also, to enable increase in testing, NCDC and partners, are supporting the rollout of approved, antigen-based rapid diagnosis test kits, in hospitals and in some select closed settings to provide, rapid point of care tests at rapid points of care. Notwithstanding that, we must not be complacent. There are still risks to Nigeria, especially with the poor adherence to the public health and social measures, and of course the emergence of the variants of concern also globally. So we want to appeal to all Nigerians to continue to adhere to the preventive, measures to get, your COVID vaccine if you are eligible. And if you have symptoms of COVID, please ensure you present yourself for testing. The responsibility to protect our country lies, with us, all of us, the government, and all the individuals, in the country.
Indeed, all of the measures working together, the NPIs, the testing, the contact tracing. But with what the NCDC set out from the beginning in terms of the sample testing target, would you say that you have met that?
So initially, the target we had was 1%, and NCDC has surpassed that 1% long time ago. So we are looking at, going further to give ourselves, another target, working with what the WHO has provided as a target for countries.
So let's talk about the variants. How much is the NCDC monitoring the different types that we have in the country at the moment?
So, concerted efforts are being made to increase, the Nigeria's genomic surveillance capacity. This is mainly focusing, on centers that already have existing genomic capacity. I want to mention here that as of today, a total of 838 sequences have been conducted in Nigeria. However, only about 134 variants of concern have been identified so far. These variants of concern that I'm referring to are really the B117 that is now referred to as the alpha variant. So irrespective of which variant we're talking about, the non-pharmaceutical interventions remain effective in controlling COVID-19 pandemic. So this means that we must all continue to take individual and collective responsibility to limit transmission of the virus, in Nigeria.
All right, we appreciate your time. Thank you so much, Dr. Abubakar Jafia, the Assistant Director Surveillance Epidemiology with the NCDC. Thank you for joining us at this time.
Thank you for having me.